I am at Rishikesh AIMS now, and half of country have students like this. And Aniket was one who is in this video working as an actor. It's a extempore. We decided that day that we will make ABC of FECO. So we remember 5 P's: proper preparations prevents poor performance. So make sure what you are going to do. That don't decide on the spot. I can decide on the spot, and I sometimes regret. I should decide beforehand, this patient, what I have to do, which kind of flap, where, site, and all that thing. So be prepared that, and always be sure about that you have put the betadine in the conjunctival sac at least before 10 minutes or 5 minutes we say, but in fact we put sometime 20 minutes before. My resident do that, but generally 10 minutes is good enough to do it, and not the 10%, not the 10%, does somebody advocate that? And then you have case selections, and you should know self-sealing inlet during SICS, capsular opening you must have learned, hydro procedures you must have learned SICS, working of FECO machine you must learn outside the eye, nuclear handling. So SICS is this which tells you all. Instructors intend to take you to FECO surgery as parents took you to the cycling without hard falls. So there will be falls in the FECO learning, but when you were teaching cycling to your child, you were holding him for a while, for few days, and then you were, without telling him, leaving him. So then you expect that he will fall sometime. So the fall, when he has learned cycling, will be soft. If he has not learned cycling, he might injure himself. So this is what all about learning. Case selection is FECO. Choose an eye which is prominent, has deep AC, fully dilated pupil, grade 2 to 3. So beginners should not attempt the very soft cataract. Soft cataracts are very bad for FECO. Hard cataracts are very bad for FECO. Soft cataracts, you cannot rotate them. They will just cheese wire, whatever you do. Even in SICS, the very soft cataracts are very bad. My complication mostly in SICS is in a soft cataract, when you cannot take out the nucleus out. So you have to do multiple time of hydrodissection, secondary, tertiary, whatever time you do dissection. And speculum is one enemy you must recognize. Speculum sometime in FECO would not allow you to enter what you want to do. It comes in between you. So see if it is with the screw, sometimes that gives a better opening. But then you must have that don't come in your way. I do superior temporal on right side. I do left side superior temporal, but sit on the left side little, like this. So I sit there. I don't sit at 12 o'clock for left eye at all. If I want superior temporal on the left eye, I must sit here. I make one port here. And then you must have the right-hander that where I will be comfortable making my incision. So when you are making superior temporal in the left side, sit on the left side little. So patient comfort is, this doctor is again, I think, very famous doctor in Banaras now, and Aniket is sitting here, this tall man. Patient comfort and your comfort is very important before starting the surgery, any surgery. Check your pedals, check your IPD, check your everything, no palpitation before starting surgery. FECO में palpitation पहले ही शुरू हो जाएगा तो टूटेगा ही, फिर तो गिरेगा ही कुछ ना कुछ ना. So make sure that you're focusing, your seat, your height, when you sit there and then you say, call me, take me up, take me down, that thing should not be done. Before patient you have started, make sure that your eye, your brain, your focus, your deep breathing, comfortable. Then you start FECO. And Acharya Kelman said, no alcohol 48 hours prior to FECO surgery. He told that, I don't know how many of you follow it. I follow mostly. I follow mostly that I avoid alcohol always before surgery day. 24 hours at least, not 48 hours. And now, of course, I virtually giving it up, like I'm not coming to night parties here these days. I taught you all dancing, but I don't dance now. Learn these things. You need both hands for FECO surgery. Your steady both hands are must. This simple technique you will see in the village mela. So make two, put one wire, put one chabi, and उसमें तो क्या होता है, current आता है, आवाज करता है. Once it touch, you can buy that. You have a wire and a battery which tells you if you touch it, it will make a sound. So learn to put this key like this without touching. Here, here, and left hand. So bidextrous, learn the steadiness of fingers and this joint, and use the wrist. Wrist is one which is required in FECO, not the elbow, not the kanda, not at all. So learn that in the child, means whatever way you learn, left hand during SICS, left hand wherever you can. And these things should be done well before you are going to do FECO. This doesn't require money, it doesn't require anything. Only thing I found it lethargic. You tell them these things, they just laugh it away and go away. We'll go to see the movie, but don't do this exercise. I give them a foil, Rexis, make the Rexis mark on a foil, aluminum foil. Tighten it on a bottle, wide bottle. It makes beautiful Rexis. And once you do the 50 Rexis like this on a foil, your fingers you will know that you are moving where. And put a red butter paper under that foil, you know the red reflex also. So learn the Rexis outside the eye. Learn hand-eye coordination in artificial eye outside. That if you can have a wet lab like this, then it's much better that you learn it outside. You learn suturing on thermocol. This is artificial eye where you can learn Rexis, where you can learn the the trenching, where you can separation you can learn. There was here I was trying to teach yesterday in the here wet lab, but you know even one candidate to take, it will take 1 hour to teach this setup. So ये बना तो दिया setup, but ये सब फर्जी है, नकली है. It's not really doing much to you. Teaching here is very difficult. Wet lab, how can I teach the FECO to someone in the cabin, though there is an instrument and 3 water bottles have gone in one person or 4 water bottles have gone down, because beginner cannot virtually control things like, and this artificial eye is not a bag, it's not a capsular bag. So it tends to flow anywhere, but it gives a very good feeling of the nucleus, that you can do the trenching and you can learn both foot use, you can learn the artificial eye doing something, FECO learning, is very good, very, very good. It costs 110 rupees. And this simple one I thought of, that left hand use, put a chapati in a fixed something, you can improve on it. Take a plate where chapati or paratha is fixed, like Rexis, like a lens, it's not moving. So once you put that and left hand you rotate it, you will learn to rotate. So then, you know, when we rotate the nucleus in FECO, we don't push. We must rotate. We must not pull it like this, we not push it like this. This technique of eating the chapati, rotating it, eating it, rotating it, cutting it, rotating it, cutting it. You will learn the FECO virtually with the roti. Okay? Do that. Understanding dynamic fluids and mechanism of FECO machine, I think you must have known. FECO has got a piece which has to break the nucleus, and it has a irrigation, it has a vacuum, it has a aspiration flow rate, and power to break it, power to break the nucleus. These are components of the FECO, and outflow is what you fix like 20 cc per minute. But take into account, allow me a time, I can go on? Yes, sir. Okay, so there is extra flow from the side ports and all that. So I try to make it shorter, but so a device to break it, wet lab, learn as much as you can. And this is, of course, simply tells you that it is a bottle and one tube, this and the FECO, where the outflow and vacuum. All old machine has this one, and you have to set them. But like Century, you have to set only tension. That I will do FECO at 30 millimeter of mercury, so it decides every parameter itself. So that is what the new machines have done. But old machine, what you have, Oertli or AMO compact, I can do still any kind of cataract. I have learned now that I can raise the 500 vacuum and use the minimum energy. So basic is can be done by anything. Hello. So main function, irrigation, aspiration, emulsification, pumps. You know that there are peristaltic routinely in all machines. There is a vacuum, hardly used these days, Venturi pump, because these new pumps are peristaltic, safety of peristaltic, but with a very short time rise. So they work like Venturi. So once you catch a nucleus in these new machines, it will catch up very fast. And then you can do chopping or whatever chopping you want to do, chop and stop or divide and conquer, whatever you want to learn. Direct chop, don't think for much more time. I found virtually no big advantage of direct chop when I compare the timings, because making trench, making two pieces, bringing it up samne, one cotyledon, and then doing the virtually vacuum eating. No phaco using, virtually no feeding, you just use few pulses. So direct chopping in a hard cataract is a very big risk, because there is no movement place in the bag. So direct chop in a grade 5 cataract, you have to catch it under the little middle se aage, down towards the 6 o'clock.
Console,
and then you have to
console, allow the video to continue. Console, allow it.
It has a video? No, I think
sir, your
आगे होगा शायद. आगे है शायद कुछ something. This is the new pumps which we call the scroll pumps. That scroll goes like this, inside scroll goes opposite side. So this maintains the chamber. This maintains the chamber, and these are in newer machines like Infinity, Centurion, etc. But our old machines are peristaltic, but they also have a virtually now better control, surge control, and basically it is a machine like your clutch and brake in the car, that you learn that I will press it how much, small, this, so you can control your everything, vacuum and everything. Say this is Infinity a soft, it's a motherboard of console, so it has a commands on foot pedals and everything, and it has a torsional and a straight both. So if you have these, not necessary that you have to this. I generally don't recommend that you must have it. Absolutely not. You basic, all these years, till I was in Subharti, I used the basic machines. Now in AIMS Rishikesh, we have got Infinity. But there also we have got a now AMO, which has been sold to, I think, Johnson & Johnson, a machine which has got again power, outflow, and the vacuum, which is under my control. So that gives me better. Still, I am much happier with those kind of machines. So this has a irrigation, bottle height can be 60 to 5 centimeters. You can keep it down when PCR happens and other things changes. So bottle height, whenever you feel chamber is shallow, you can raise the bottle height. When PCR occurs, lower the bottle height, lower the vacuum, lower the power. So these are phaco tips, 15 degree, 30 degree, 40 degree, Kelman tip. 0 is one complete occlusion, 15 is 90% occlusion, 30 is little less, 45 is cutter, not occlusion much. Kelman tip gives you both way, side way and this one, but see that when you are starting beginner, that this is not torn, it's not coming out of a hole somewhere else. And 30 degree has been accepted universally, mostly by people, that, and Americans throw every tip after every use, they throw bottle after every use. Every AIS also recommended that one bottle for one patient, no evidence-based. It is not evidence-based. I told people that does water goes to the bottle back ever in phaco? From the eye or from the tube? Never. It just cannot go to the hanging bottle which is hanging there. So why you want to change bottle in every patient? I don't know why this recommendation came, but this recommendation of AIS and this is recommendation that you must use one bottle for one patient. Americans say one tip for one patient, and they really throw one tip after one patient. And you must slide tip after every surgery, which none of us does. So what I do is I put the phaco here and I put the spirit swab around it till next patient. That is what I do. So I don't change the tip or anything. Again, use the ideal
you
something.
need to change the tip, sir. You should have different set of tips. Please don't.
Please, you have na Guru Nanak Eye Center have so much money. Kejriwal gives you everything. We don't get anything. No? Like, Kejriwal gives the free everything. So phaco power is frequency plus stroke length. Frequency plus stroke length. Phaco power, most of you may not be knowing, that when I asked in a big hall few years back, the big surgeons also, how much is the 100% power the phaco tip will enter the nucleus? Mostly somebody say 1 millimeter, 2 millimeter. 100% power means 0.1016 millimeter. 100 powers means it will go 0.1016 millimeter. So think of 50% power, 30% power. So it virtually goes very little inside that. Only thing it goes again and again so that it deepens it. But so 100% power is that. And these excursions which are told here, still no machine can vouch that what I am writing on this machine, this is this. The frequency varies between 28,000 to 40,000 per second. So, and this is 100% power. You take the hammer from 100% power and 30% power. So 30% power may not break it completely, 100%, and this is the cavitation effect. So two ways phaco works, cavitation and jackhammer. So jackhammer is phaco power, and cavitation is when this tip goes and moves, it produces vacuum. And then there is a vacuum means lot of fluid comes and break the nucleus. So this is cavitation. तो ये चूहा जो है cavitation कर रहा है, and that is jackhammer. Small 30%, 100%. So that breaks it. And cavitation like rat does. So that is cavitation. So the two-way phaco machine function. And the torsional phaco recently has come where you possibly have less chattering, that your pieces would not run away if you move it side to side. So it's moving side to side, so it will catch all the pieces. So that is advantage of the oscillation or torsional phaco, which came in the Infinity, which has come in an AMO also now. And power modes can be continuous, linear. There are pulses which are off, on, 50, 100 millisecond on, 50, 100 millisecond off. That is the phaco power. The pulse. Burst is that when you start so many pulses together. You started with 5 pulses, then it became 6, 8, 10, this, and then it become burst. So this diagram will show you. Hyperpulse is small duration, so many pulses. Hyperpulses. So these are the various kind of energy which can be delivered. And in whatever machine you have got, they have got it. You can do it. You can use it according to your requirement. You customize yourself what you want. Continuous power, fixed mode and linear mode, ऐसे शुरू करोगे बढ़ता जाएगा. So suddenly pedal पे नहीं दबाना चाहिए कुछ भी. Start with a small and go down slowly. Intermittent power is on and off. Reduce the phaco power. It's a pulse mode, 30 pulses per second. Hyperpulse is many pulses per second, but छोटे वाला. So burst mode, hyperburst mode, these are all kinds of energy that you, all purpose is that you break the nucleus with minimum power and then use the maximum vacuum to take it. And surge control is the only thing comes there. So there is a, see now, this is keep on moving and then keep on sucking it. The machine senses when phaco tip is nearing occlusion. It sends a burst of energy to prevent total occlusion and allows lens matter to adjust and continue to flow into the tip. So these are the newer machines which are safer because of their own sensory method, own reading what is required, and they do themselves, the machine do that themselves. That is the safety of the costly machines. But again, your Indian mind adjust with the local machine, these smaller machines also. The outflow is, you can set 25 to 40 centimeter per minute, vacuum 0 to 600. So basically trenching you require less. Everything will tell you that. Rise time is when it takes time to reach that power. So that is rise time. It's a teaching like basic teaching. Followability is that you want these pieces to come towards your tip. So you will increase the outflow. Pani ज़्यादा बाहर जाएगा तो they will tip, these pieces will come towards your tip. That is followability. I think this one also shows that. So these small pieces of the That day we have peanuts only, we thought. And small pieces, if they have to go more in, then you have to flow out more. If water flow will be more through your tip, then these pieces will come towards your tip. That's it. So that is flowability. And this is fluid inflow, outflow balance. This is a physics formula. I need to not to go into details of this. Inflow, outflow depends on the caliber of the tubes, power, anything, so many things, bottle heights. So surge is basically that, then when this piece goes into this tip, then suddenly this tube opens up. And then you have the collapse of the chamber, that is the surge.
Sir, thoda
Faster? Please, no, sorry, no. चल रहा है कि नहीं चल रहा? ये दिखाया piece है, let's see that is working or not. How to reduce surge? एक मिनट जैसे surge reduce करने के bottle height, the tubing should be non-compliant with the rigid tubes, and there are machines which give the venting, that when it is about to go, piece go about to in, it sends the fluid through the system or air through the system. And mine is, of course, surge control is by anti chamber maintainer of 300 rupees, which will keep the chamber deep all the time. So any hard cataract I am doing phaco, I will use the anti chamber maintainer to keep the surge control. So modulation power, customize yourself. This is my way of phaco. One, I use 40% power, flow 25 cc, vacuum 50 millimeter when I am making trench. When I have made a trench, separated two pieces, I bring one outside, one in front of me, pulse, 40% power, flow 34 cc, vacuum 400, now I take 500, mostly, always. And phaco 3 is again, when your mostly pieces are eaten, then you have just small pieces remaining of the cortex or epinucleus, then you have phaco power 30%, pulses, flow 25 cc, vacuum 120 mm. So, conclusion is proper case selection, surgeon comfort and everything initially, how you use. Thank you very much. Thank you. Thank you.
Thank you very much, sir. It was a wonderful presentation as always. And